Alrighty, here we go again, talking about GI problems that can happen from bed rest. Constipation is a huge one. Because we are not moving, their activities decrease, their mobility slows down, and therefore the peristalsis, the movement of the intestine, is not happening. Okay? If somebody's on bed rest, their gut is not going to work very well. The best way to get somebody to start passing gas or moving having a bowel movement is getting up and moving. However, they cannot do that and they're stuck on bed rest. We need to figure out what we can do for them. And I don't know if Miss Betty Jo's kids know this, but my students do know this, and Miss Chrissy's have heard this story. Think of a baby. When a baby is gassy or constipated, they can't walk. Babies don't walk. So usually we'll put the baby on their back and we'll kind of bicycle legs. We'll put their legs up and down, like they're pedaling a bicycle. And then the baby will start to release a little bit of gas and start to feel better. Okay, you're not going to do that with an adult patient. So if they're on bed rest and they cannot move their bowels, you need to let the nurse know. You need to keep track of those bowel movements. If it's been more than 2 days, the nurse can call a doctor, get stuff to help with the bowels. You can also lay the person on their left side because that stimulates the dropping of the gas and the passing. Okay, so to the left side is a good way. We might have to do suppositories or laxatives. If they're able to exercise, you're going to get up and exercise. And if they can't, you could do the movement of their legs for them by the range of motion exercises. Encourage warm fluids because that stimulates the peristalsis and the movements. Okay, assist with their bowel training, know their pattern, check their care plans so you know, it's typical that Mr. Smith doesn't poop for 3 days. It's not a big deal. But it is a big deal if it's been 6 days and he hasn't had poop. So you need to know their regimen. Um, Provide for privacy when you're toileting or when they're toileting, and always keep track of those bowel movements to help the nurses out with that. Okay, constipation is not fun. Your patients are very irritable and crabby, and it can lead to big gut problems if we don't fix it. How to prevent bed rest complications? These important nursing measures help prevent the complication of bed rest. Good alignment, keeping your patient aligned, doing the range of motion exercises, and repositioning them frequently, every 1 to 2 hours if they're on bed rest. Okay, good alignment. I don't know if you guys remember what that is, but it's like you put a person in position. Maybe you're going to lay them to their left side. And when you get them on their left side, you're going to go and you're going to look, stand at the foot of the bed and say, is this person straight? They should not look like a chalked murder line from, like, criminal investigations or whatever. Or, it should be straight, meaning the legs are straight, the arms are straight, they're aligned. If they're on their back, remember supine is in a line and they are fine because they are on their spine. Think about that. If they're laying on their back, they should be perfectly straight. You sit at the foot of the bed and you can draw an imaginary line from the middle of their forehead all the way down to where you're standing, a perfectly straight line. That is good alignment. Okay. Um, there's also pictures of contracture and atrophy on page 397 for you. Alrighty. How do we keep this alignment that I'm so talking about? And how do we position them? How do we keep them that way? What if they keep rolling side to side, Miss Bartels? What do I do? There's different devices that we can use to keep them in position. Okay. Some support devices that I'm going to talk about. The first one is that we use is a footboard. It prevents plantar flexion. Plantar flexion is when the foot drops downward. So when somebody's in bed, if their foot starts to drop down, like they're stepping on the gas pedal, and it gets stuck that way, it stays that way, could they walk? Their foot's stuck in a down position, they could not walk. So we don't want foot drop to happen, so we use footboards to prevent it. There's a picture of footboard on page 398, figure 27.3. Take a look at that. Okay. Again, it's so the feet don't drop downwards. If somebody lands on a permanent foot drop, they'll never be able to walk again because you have to be able to have your feet flex to walk. All right. Trochanter rolls are the next one that we're going to talk about.